Okay, I'm Dr. Heather Sequeira, so I'm a consultant psychologist and an expert in trauma and trauma linked OCD. I work with people who are dealing with the effects of trauma, so whether that's post traumatic stress disorder, anxiety, dissociation, shame, or also OCD. In other words, fears and behaviors that might not make sense to anybody else, but they often have their roots in trauma. So many of my clients have had therapy before, sometimes many times, but despite having therapy before, they often still feel stuck. And often it's because of the trauma that underlines their symptoms that hasn't been recognized or directly addressed. And that's where my approach is different. I developed the clinical framework called the Trauma Linked Compulsivity Model, or the TLC model, and it helps us understand why some OCD isn't just an irrational fear, but it's a survival driven response to shame, trauma, or emotional threat. So, alongside my private clinical work, I also lead the local NHS service in my NHS trust in the UK. I also work with the British Psychological Society, delivering advanced training for psychologists, and I serve as an honorary research fellow at the University of Birmingham. And my focus is always on using practical, evidence based tools delivered with care to help people make real progress and move forward as efficiently and as effectively as possible. Okay, that's a really good question. I first came into psychology through research. I wanted to understand how people respond to adversity. So, not just emotionally, but at the level of their body and their relationships. And it was through clinical work that I first saw how powerful psychology could be, not just as a science, but as a way of helping people regain that sense of calm and control in their life and moving forward. There's also a personal reason why I do this work. Like many people, I've experienced OCD myself. I've experienced the anxiety and the looping thoughts and the feelings of being stuck in patterns that don't make sense to other people. And that experience has deepened my own commitment to understanding OCD more fully. So, not just what it looks like on the surface, but what's driving it underneath and how to treat it, how to help people in a way that is truly effective, in a way that's kind, and in a way that absolutely works, help them get the kind of lives that they want to live. For me, it's the moment when somebody says, I've never had it explained like that before. Now it makes sense to me. Or when they say, I finally understand why I do these things, why I'm behaving in this way, and now I can move forward. Because I think it's through helping people move from shame and confusion and into clarity and choice. That's what keeps me doing this work. And I also find it incredibly rewarding to train and supervise other clinicians, other psychologists, because trauma and OCD linked to trauma is often misunderstood, even within our own profession. So when I see a colleague gain confidence in this area and start to bring those insights into their work, I find that really meaningful too. So whether I'm in the training room or in the therapy room, working directly with people, I really care. I really care about creating a space that's calm and clear and clinically grounded. And that, of course, is where the good work happens. That's where people can make that change that makes all the difference to their life going forward. I think clients often tell me that they value the balance of calm and structure that I give them. They need therapy that feels safe, but also therapy that isn't passive, because there has to be a clear process. There have to be things that we do in therapy that we put in place to make a difference. And also, clients, I think, really value that understanding of why we're doing what we're doing. and the things that they can do that will take their life forward. I think also they appreciate being seen in full, not just as a symptom or a diagnosis, but as a person with a story, somebody with a history, and somebody who's been doing their best to cope with things despite lots of difficulties. And in turn, what I value most is their courage, because it takes immense strength to look inward, especially when you've been living with distress for a long time. And for the professionals I work with, I really admire their willingness to rethink and to go deeper and to keep learning. So there's a lot I value about all the people I work with. There's a few principles as well that I return to again and again. And these are things like the brain is trying to protect you. And I always come back to that. But sometimes our brain's trying to protect us in ways that no longer serve us. And I use this all the time to help shift people out of blame, out of their own self-blame, and into understanding. And I think another key point that I just want to leave here is that trauma isn't just about what's happened to us. It's not the story so much of what's happened to us. It's how that story has become stuck in our nervous system. And that's why I integrate body-based tools into CBT and into exposure and response prevention, because many people don't just need to think differently. They actually need to feel safe. They need to start to feel safe in their own body, in their own experiences. And so now my work integrates evidence-based CBT with trauma-focused and body-based approaches. Because for many of us, healing isn't just about our thinking differently. It's about feeling in control of our own body, in control of our own brains, and reclaiming that sense of control.